Hello and welcome to another edition of Kaleidoscope on Channels Television. I'm Anne Nwawadu. Coming up on the program today, we take a look at the activities of the non-governmental organization called Drasa, an NGO established in memory of the late Dr. Stella Dadavo, who saved Nigeria from the deadly Ebola crisis of 2014. Once again, welcome to the program. In mid-2014, we had a health scare and Nigeria was not spared. Health workers took the hit. But fast forward 6 years after, another health scare, COVID-19, hit Nigeria, and many health workers have also died in the line of duty. But according to an NGO known as Drasa, these deaths could have been avoided. It all began in 1976. A new deadly virus reared its ugly head, hitting Yambuku in the Democratic Republic of Congo and Azara, a town in South Sudan. July 20, 2014. The Ebola virus disease was brought into Nigeria by Liberian-American Mr. Patrick Sawyer, who came into the country from Liberia. The late Patrick Sawyer visited the First Consultant Hospital in Lagos, southwest Nigeria, where he was being treated for an illness which would later be identified as Ebola. One woman, Dr. Stella Ameyo Adadavo, smelled a rat and prevented Mr. Sawyer from leaving the hospital. Despite pressure from high authorities to release him, she stood her ground, sacrificing her life in the process. August 19, 2014, Nigeria lost Dr. Stella Adadavo. 3 more health workers at the hospital also paid the ultimate sacrifice. Till date, Dr. Stella Adadavo is recognized as the heroine who saved Nigeria from a deadly crisis that would have claimed several lives. But the question is, could the death of Dr. Stella Adadavo and other health workers have been prevented? The answer to this question has inspired the establishment of Drasa Health Trust, a non-governmental organization which focuses on public health. Established in 2015, Drasa is an acronym for Dr. Ameyo Stella Adadavo. Her niece, Mrs. Niniola Williams, who believes in building sustainable resilience, thereby bridging the gap in the health sector, began the NGO in memory of Dr. Adadavo. With various projects from water, sanitation and hygiene known as WASH, infection prevention and control IPC, antimicrobial and antibiotic resistance AMR, and outbreak and health emergency preparedness. Drasa's key interventions include training programs, simulation exercises, community education and outreach, policy development and review, audits, risk management, and advocacy. I had a chat with the managing director of the organization, Mrs. Niniola Williams, and we discussed the Ebola crisis of 2014 and how it affected the health sector.
It was, of course, a very tense and anxious period. Anytime a new virus is introduced, something unknown, something very uncertain, something clearly very deadly, it's hard to deal with it. But she was brave, she was courageous. She and the members of her team did what they had to do to save the rest of us. And unfortunately, 4 of them lost their lives in the process. But it's really hard to say what would have happened. We know that it would have been a catastrophe. The hospital was located in Obalende in Lagos, a very densely populated area of Nigeria's mega city. So all he had to do was just step outside that hospital, and we don't know what the results would have been.
Did Dr. Adadavo have to sacrifice her life? Couldn't have been something that would have been done for us not to lose a health worker?
I think there are a few things that could have been done differently, but at the end of the day, this was the first time we were having Ebola in Nigeria. Nobody really knew what to do. There was a lot of confusion, a lot of people scrambling and just trying to quickly take action to stop it. And lack of training, lack of preparation, the fact that we were not prepared is really what caused a lot of these things.
And talking about preparation, really brings me to your NGO, yes, which is Drasa Health Trust. What is Drasa Health Trust about?
Drasa Health Trust is about protecting our public health. So how do we safeguard this nation and ensure that everyone is protected from potential health emergencies like Ebola outbreak, Lassa fever, yellow fever, and now, for example, COVID-19. And so we're looking at how do we strengthen and build resilience within Nigeria's health sector? How do we ensure that every community has the water and sanitation they need to maintain good hygiene, good habits that will ensure that they stay healthy? How do we build the capacity of health workers to be able to do what Dr. Adadevoh and her team did? If we have more people like that across the country, we know that we will be safe from whatever could come next. We're facing COVID-19 now, but we don't know what the next one is going to be. One of our flagship programs in the community, at the community level, is actually working with students. We know Nigeria is a very youthful country. We have a lot of youth, and we have decided to leverage on that. And so what we've done is set up health and hygiene clubs in secondary schools. And so we have these students, we call them our Drasa ambassadors, and they go out into their communities to address issues of water, sanitation, environmental hygiene, issues that can cause and lead to illness and disease. And they are now the ones that are the advocates to fixing those problems in their communities with our support and our help.
Okay, and how far have you gone? When did this all start? When did Drasa start?
Drasa started in 2015, and our school program started in 2016. And then our training program to build health workers, the capacity of health workers to identify and contain infectious diseases, started in 2017.
So what inspired Drasa, really?
The inspiration behind Drasa was really, how do we prevent unnecessary death? Dr. Adadevoh and 3 members of her team sacrificed themselves to save the rest of us. And while we celebrate them and we know that what they did was for the greater public good, as she said at the time, they didn't have to die to protect us. There are ways that we could have helped them, supported them, built their capacity so that they could do what they did, contain the disease, but without contracting it themselves and dying from it.
We had about 8 deaths and 20 cases in Nigeria, and more than 50% of those deaths were actually health workers.
Yes.
Which, if you ask me, was a lot.
Yes. Yes.
What is your organization doing in terms of training health workers so that this doesn't happen again, or they learn how to better protect themselves in cases of infectious diseases?
Yeah, so we have a training program and a capacity building program on the topic of IPC, which is Infection Prevention and Control. And the idea is that we know that Nigeria already has a shortage of health workers. If you look at the number of doctors, for example, we have less than 4 doctors for every 10,000 people. So we really cannot afford to put them in the line of fire where they will end up losing their lives while serving us and doing their duty. And so through this training program, we ensure that they can do the right thing, but in a safe manner. And the way we like to compare it is if you think about the fact that you and I, for example, we're not soldiers, right? But imagine if somebody took us to the battlefield, the front lines, and gave us a few weapons and said, okay, go and do the work. We would have no idea how to fight. We definitely would not win the war or the battle, and we may lose our lives in the process. And so that's really the essence of what we're doing with IPC. We're ensuring that our health workers are protected, they're confident, they're capable of doing what they need to do when they're faced with these kind of emergencies.
All right. So when you're faced with this kind of emergencies, for example, when Ebola came to Nigeria, Dr. Adadevoh was only able to identify Ebola because she had heard about Ebola.
Yes.
Imagine in a case where Nigeria becomes the first country to have a kind of disease, a type of disease. Take, for example, when COVID-19 happened in China, it was never heard before. It just happened. In cases where Nigeria becomes the first country to have that kind of disease, what is your foundation doing in terms of research about diseases, infectious diseases, so that even when it comes, you can identify it?
Yeah, so again, that's the essence of IPC, Infection Prevention and Control. It's all about how do we build a workforce that is prepared no matter what, whether it's Ebola, Lassa fever, monkeypox, yellow fever, COVID-19, or something we don't even have a name for yet, something new. IPC will ensure that these health workers know what to do. It will ensure that regardless of the actual pathogen, the actual deadly virus or bacteria, they have the skills and principles they need to treat the patient, contain the threat, and protect themselves in the process.
And how many health workers are you looking at?
We're looking to train 10,000 or more every single year, because we really need a nationwide network of these people at our land borders, at our airports, within our communities and our health facilities all over the place. We need people who are trained, ready. You can think of it like investing in our army or our air force. You know, we have a military to protect us from threats. We need to have a trained health workforce to protect us from future public health threats.
Let's talk about Drasa now and the impact that has already been done. Drasa started back in 2015, yes. But let's say really 2017 when the IPC started. What impact have you made? This is 2020.
Yeah.
It means we've done 5 years down
Yes.
the line. Can you pinpoint what Drasa has been able to do, or an impact on the society that Drasa has been able to achieve?
Yeah, I mean, we've trained thousands of health workers. We've reached tens of thousands of students and teachers around the country. We've worked in many different states across the country. We're continuing to push, but again, you know, we can't do it alone. We're a small organization. We have partnerships and collaborations, and that's really how we can go further. But we're very interested in working with Nigerians to improve this country, improve our healthcare, and ensure that we can be better the next time around.
And what feedback do you get from the impact already made?
We have great feedback. I mean, we've trained people, we've built their capacity, we've worked with different state governments who have asked us to come back and do further work with them. There's clearly a gap that's being filled by the work that we're doing. It's just a matter of how do we go further and go faster.
All right, so let's go personal now about late Dr. Stella Adadevoh. I know you're her niece. How did the family take the death of Dr. Stella Adadevoh in terms of how was the feeling in the family when this happened? Did you think that Nigeria has also done enough to celebrate her?
Of course, it was a very difficult time for us. It still is. You know, we miss her every day. But that is why we have chosen to put all our efforts towards Drasa, towards the NGO. As an organization, we believe that we are doing our part, at least, to continue her legacy. She and her colleagues who gave their lives for the rest of us, the work that they did should not just be something we talk about in a book or we read about in a newspaper. It has to live beyond that. And we are trying to do our part to make that practical, to improve the country, to continue saving lives the way they did. And that's really what we focus our efforts on. And that's how we honor her. That's how we keep her memory alive.
So let's go back to July 20th, 2014, when the first case of Ebola was imported into Nigeria.
Yes.
From what we know about Dr. Stella Adadevoh, she stood her ground. She said, no, you cannot leave this hospital until at least we know what is wrong with you. Yeah. Is that the kind of person she is naturally, you being related to her?
Yeah, 100%. When she believed in something, when she knew what was right and what was wrong, she stood for it. And there was no movement from there. And I think that you know, sometimes we wish she wasn't like that because maybe she would still be alive, but that's who she was, that's who she always was, and yeah.
And do you think there's so many Nigerians still willing to sacrifice their lives, even though we can actually prevent that from happening?
I think there are some Nigerians who are tirelessly patriotic and believe in this country to the end, but I also think there are a lot of Nigerians who are not willing to do that. And I think we have to find a balance. You know, we don't have to sacrifice ourselves for the good of this country. We have to find ways to support the country, improve things, but also maintain and sustain life.
You're still watching Kaleidoscope on Channels Television. When we return, we'll continue the discussion. Please stay with us. Welcome back. The non-governmental organization Drasa will now focus on infection prevention and control. Let's find out what their plans are in terms of operation and funding.
So again, we go back to our founding principle. We were founded in memory of an individual who sacrificed her life in the line of duty, working in a hospital. And so one of our mandates is how do we protect others who are doing the same type of work. And so with IPC, infection prevention and control, it's a discipline that helps health workers do their job in a safe way. And really, we're looking at building resilience through building the capacity of the humans that work in our health sector. So we know we have a lot of people investing in infrastructure, building hospitals, building isolation centers for COVID, providing equipment, you know, ventilators, personal protective equipment, gloves, masks, and all of those things. And those things are good. They're very, very important. But if we build an isolation center and we put all the fancy equipment there and all the PPEs there, and we don't have skilled, capable health workers to work in that environment, there's no way we can have a successful response to any public health threats. And so for Drasa, what we are looking at doing is building that human capacity, investing in the individuals that make our health sector what it is. Because we can see how just a small team of doctors in a private hospital in one city in Nigeria literally changed the course of history and saved we don't know how many lives. So if we can have more people like that around the country, then we know that we are safer and we are healthier. Through our IPC program, we've trained over 2,000 health workers across the country. And while that's good, we know we have to go further. And the whole point of IPC is really, how do we ensure that Nigeria is prepared for whatever may come next? We were not prepared for Ebola. We were somewhat prepared for COVID-19. We know there will be more that will come in the future. So how do we build resilience and sustainability? So rather than waiting for the thing to come and then reacting to it, how do we ensure that we're proactive, that before anything happens, we already have the capacity we need to deal with it? And that's really the core of what we're trying to build with this IPC training.
A lot of health workers are actually looking for greener pasture outside of Nigeria. It means that there's something affecting them in Nigeria they're not happy about.
Yeah.
Will Drasa also be working to make these health workers happy? Because if they're not happy, then they can't make their patients happy.
Of course.
What is Drasa doing in terms of changing the narrative of health workers in Nigeria?
Yeah, I think, again, it goes back to everyone wants to feel valued. Everyone wants to feel that they're making a contribution and it's being acknowledged. And that's really what we look at doing. We don't look at our health workers as just people who are supposed to do this. It's hard to be a health worker. It's not something that, everybody should be able to do. You have to be selfless. You have to be dedicated. You have to be committed. And we are invested in making sure that they are supported in every way. They have all that they need to do their jobs. Because at the end of the day, they're serving the rest of us. And we have to be able to be there for them as well.
In terms of training now, we talked about the simulation. There will be a center.
Yes.
Can you walk us through how this will really work?
Yeah, so...
Because I know they won't be dealing with the real thing. So
of course.
It has to be an imagination. Walk us through how this center will work.
Yeah, so the reason we've decided to use simulation is because it's a very good, effective learning tool. And it started in the aviation industry. I'm sure you know that you can be a pilot, except you have several hours of flight simulation. You can't go onto a plane for the first time and say you're a pilot. So we need to do the same thing in our health sector, and we don't. We graduate doctors from medical school and we throw them into the field, and we do the same for nurses, pharmacists, and others. And they don't have a chance to really practice what they've been taught in a safe, contained environment where there can be no real harm. So before you come before a real patient, you can simulate what it would be like. So imagine if Dr. Dadavo and her team could have simulated Ebola before meeting that first patient. Perhaps they wouldn't have lost their lives. And the same thing follows. So that's what we're looking at doing, is how do we create a space for people to learn how to respond to something dangerous and deadly, but let it be neutral, as in there's no actual threat. And they can make mistakes there, they can learn from their mistakes, and then they can go into the real world and apply what they've been taught. And of course, this is something that's currently not being practiced in the health sector. So in the education of these health professionals, they don't get a chance to learn IPC in this way. And that's really why we're trying to fill that gap.
In terms of training, are you looking at training only indigenous people and resource persons who will come for this training? Are you looking outside Nigeria, or it's just going to be a Nigerian thing?
Well, we set it up to be a Nigerian thing. We strongly believe that we should be investing in our country and making our country better, but we are definitely tapping into resources from outside the country and around the world. We have technical partners who will be supporting this program and others, but our real goal is to build our internal capacity so that we don't always have to look outside and that we can have what we need right here.
All right, so let's talk about health workers, really. When we talk about health workers, a lot of people just feel, oh, it's just the doctors, the nurses,
right.
Those who are going to attend to the patients. I think those are the only frontline people. But we forget the drivers are there, the cleaners are there.
Exactly.
People who work around the hospital
are
there. Are you also looking at training those people?
100%, and we've been doing that already. We believe very strongly in looking at these health facilities and the health sector as a whole. We're not just looking at the clinical staff, those that interact with patients. The people who really help the operations of a hospital to run well, the cleaners, the porters, the ambulance drivers, the security, the admin staff, those are the people who also need this type of training, because for as long as you're working in that facility and in that environment, there's a risk. People come to the hospital because they're not feeling well, because they're sick. And so everybody in that environment needs the kind of training that we're providing, and we intend to be fully inclusive in that.
You're targeting thousands of people.
Yes.
Are you going to select from hospitals? Are there people who are going to apply? I mean, tell us how this will work.
Yeah, so generally what we've been doing is working closely with the ministries of health of different states, because we know that they can best identify the people who need this kind of training most urgently. And we're also training trainers so that we can train people in a certain state, we can leave, and then they can continue, and of course with our remote support and all of that. So we're looking at targeting it that way so that we're getting to the right people at the right time. But of course, people always contact us and say, we heard you did this thing in this place, can you come and help us do the same? So we're open to collaborating with as many people as possible, because we know it's a big task we have in front of us, a lot of people that need this, and so we just need to think of the most effective way to get there. So we've been funding it through grants, individual contributions. Corporate organizations have also donated to this cause of building the capacity of health workers. But now with COVID-19, this pandemic, we know there will be another. We know that the next one may be more deadly than COVID-19 is. And so we really need to urgently scale up. And so we're looking at how do we set up Nigeria's first ever training center using simulation to ensure that this IPC thing really goes far. And so for that, we're looking for support, donations, of course, in-kind support. We're working with partners, we're collaborating. We want this to be a Nigeria effort. We want this to be something that the country owns, because we can't always wait for others to come and rescue us every time. Look at COVID-19 now. The other countries that used to come to our rescue before are facing COVID-19 where they are. Sure. So we really have to build our own internal capacity, and we hope to have the right partnerships and support to do that. We've already identified a site. We've already gotten support and donations to build the site and make it operational, and we're looking for additional support, and people can go on our website to read more about what that looks like and how it's going to function. And of course, for the IPC Simulation Center, as we're setting it up, we're looking for partners and funding. We don't have all the funding required to fully start. We've started raising money, but we're looking for people to join us, to support us along the way, and provide not just financial donations, but also in-kind things, generators, furniture, the things that we need to really equip the place to be what it needs to be to serve the country. And we're also looking for technical partners. We have some already, but we're looking for more people that can come in and make this more robust. We're looking at how do we use virtual reality as part of this simulation. We have the physical simulation mannequins or dummies that we use, but how do we use virtual reality and technology and make this innovative and creative? And again, this is the first time anything like this is being done in Nigeria, so we want to work with as many people as possible to make it a success.
Where do you see Drasa in the next 5 years?
In the next 5 years, we're going to be, with all things being equal, widely distributed across Nigeria doing this kind of work. But we're looking beyond that. We're looking at West Africa, and we're looking at the entire continent. Because what we do know is that for as long as our neighbors in the countries surrounding us are at risk, we are also at risk. We know our borders are porous. We know that these types of infectious diseases are almost always imported, and we need to build the capacity of ourselves to protect ourselves as well as our neighbors, so that we're, as a region and as a continent, stronger together.
And this is where we draw the curtains on Kaleidoscope for this week. Thank you so much for watching. Please connect with us via social media handles showing on your screen. I'll see you again soon. I'm Anne Nwawadu. Stay safe.